Welcome to the 2023 NNLM Virtual Symposium on Health Misinformation. We are glad you are able to join us today. I am Jamia Williams. I use she, her pronouns, and I'm the Consumer Health Program Specialist. We have just a few technical items to cover. All attendees have been muted, but we do welcome your questions and comments. Please put your comments in the Zoom chat at any time. B Affairs is providing technical assistance today. NNLM staff will be keeping an eye on the chat with me. Please be sure to select everyone from the drop-down menu when posting your comments in chat to ensure everyone sees them. Submit your questions for the speaker using the Q&A function to ensure they do not get lost in the chat. We have live closed captioner for this event. You can access the closed captions by clicking on the icon with the three dots and then selecting closed caption. If you would like to share on social media, we encourage you to use the hashtag for the event, HealthMisinfo NNLM. Before we get started, I would like to share a little about who we are. The National Institutes of Health is the nation's leading medical research agency. Many of you might be familiar with the National Center for Allergies and Infectious Diseases, which is one of the many institutes and centers at NIH. NLM, or the National Library of Medicine, is one of the 27 institutes and offices of the National Institutes of Health. It is the world's largest biomedical library and produces online resources like PubMed and Medline Plus. NNLM, the network of the National Library of Medicine, is an outreach program of NLM, working to ensure health professionals and the public have equal access to health information. NNLM is made up of 7 regional medical libraries, 3 national offices, and 4 national centers, all providing training, funding, and engagement opportunities to over 9,000 NNLM member organizations. It is my pleasure to introduce today's speaker, Maggie Shawcross. Yay, everyone.
It's perfectly said. Okay, so now do I share?
Yep, let me stop sharing and you have it.
Okay, so first of all, can everyone hear me okay? Let me know.
Yes.
And then do you see one giant screen full of a PowerPoint presentation?
Yes.
Oh,
yes.
Good. Okay. I'm working with 3 screens, so I'm trying to figure them all out here. So hello, everyone. My name is Maggie or Margarita Shawcross, but you can call me Maggie. Today I will be presenting Con Salud lo hay todo, empowering Latina communities through health literacy. So Con Salud means with health, lo hay todo, you have everything. Okay, so before I get started, I would like to acknowledge that the University of Northern Colorado, where I am speaking to you from, sits upon the traditional territories of the Ute, Cheyenne, Arapaho, and Lakota people, and we acknowledge that 48 tribes are historically linked to the state of Colorado and are the original stewards of this land. So for today's presentation, I hope to give you some insight about the Latina community, what our priority health concerns are, and our preferred method for accessing health information. And I want you to become aware of current research and practices that are being used to help address health information in in all communities, but some in Spanish-speaking or Latina communities. So we begin by defining who Latinas in the US are. So before we start talking about numbers, about how many Latinas, Hispanics, Latinos live in the US, I think it's important to talk about defining what is Hispanic or Latina or Latinx or what Latino is. We begin this discussion by clarifying what we mean by culture. So this is a complex word which has been used in so many ways and has come to mean many things. Many people, when they think of culture, they think of aspects of our lives that are both components of culture and influenced by culture. So these may include things like food, dress, holidays, art, music, and language. But culture impacts our lives on an even more profound level than concrete expression. It determines how we perceive the world and how we assign meaning to what we see and how we respond to it. One definition for culture that I like is that culture is a shared set of belief systems, values, practices, and assumptions which determine how we interact with and interpret the world. In today's presentation, I am focusing on the Latine community, which also has been recognized as Latinx, Latino, Latina, or Hispanic cultures. So which is it, you might say? So in the 1950s and 60s, it was more common for Latinas and the dominant culture to use the national identities such as Mexican, Mexican-American, Puerto Rican, Cuban American, Central American when describing Latinas rather than using a wider, broader term such as Hispanic. The word Hispanic wasn't widely used until the 70s and 80s and wasn't recognized in the census until the 1980 census when it was updated from the term that was referring to national identities and other Spanish. The issue with the term Hispanic is that Hispanic is not a race, but an ethnic distinction which ties individuals and communities to Hispania, a Roman name for the Iberian Peninsula or Spanish culture, and doesn't really consider racial differences found among us as a community. And frankly, some of us don't feel any connection to Spain other than the Spanish language. So more recently, within the past 20 years or so, the term Latino or Latino has risen. And this was done to encompass and recognize the racial differences found among Latinos. So we're moving away from describing folks as being Hispanic and sharing a common language of Spanish and the connection to Spain and Europe, to now folks sharing the commonalities of coming from Latin American countries or having roots in Latin American countries. So even more recently, we've seen the rise of the term Latinx. Latinx is a gender-neutral alternative to Latino or Latina, and it is a term used to describe a diverse group of people who have roots in Latin America and emerged in the queer Latinx community in order to challenge the gender binary that we find in the Spanish language. But even more recently, we have seen the rise of the use of the word Latine with an E at the end. And so now this term was created by LGBTQIA+ Spanish speakers using the letter E to illustrate the gender inclusivity within the Spanish pronunciation. So know that some older generations may feel less familiar with or might be more resistant to Latinx or Latine, but the term in general use it's rising in use among younger generations. So I have purposely used the term Latina today, and when talking about Latinas in my presentation, I am referring to folks living in the US who have roots to Latin American countries who might or might not speak Spanish, and know that at times I might say Hispanic or Latino, and that has more to do with how the researchers described the population when they were gathering their data. So hopefully it doesn't get too confusing. And though I'm lumping this group together, it is important to understand that although we are grouped together in this presentation, each subgroup has a different dialect, foods, traditions, and they're determined by the country of origin. And considerations need to be given to personal differences, racial identity, socioeconomic status, migration status, subcultures, and life experiences. Okay. So a couple of insights to the Hispanic Latina culture. So disclaimer, this is a generalization. I'm not saying that all Latina people are the same. Rather, I'm sharing with you some patterns shown to be present in the Latina culture to provide us a basis in understanding the culture which I am a part of. All the comments here are meant to be generalizations, not stereotypes. So there's cultural diversity within the culture. So diversity within the culture. Latina people are more than just Mexico. It is more than just Spanish. In total, there are 21 countries that make up Latin America, and within it, many ethnic and racial groups. Within it, a diversity of languages, with Spanish and Portuguese being predominant languages, and a diversity of religions. The second thing is the Spanish language. So Spanish is the second most widely spoken language globally in terms of native Spanish speakers. Over 474 million folks account Spanish as their first language. Language is a complex issue. And in the United States, a primarily monolingual country, language is often politicized, and the benefits of being bilingual are kind of pushed aside. Okay, now we come to the idea of familismo or familism being a collective culture. So familismo is a cultural value that emphasizes family closeness and loyalty and has been identified as a value characteristic. So it's a great thing of many Latino populations. This is in contrast to the values of individuality and independence emphasized in the dominant US culture. Familismo requires an individual family member to put their needs, the needs of the family first, even if it means making personal sacrifices. Familismo does not disappear among second or even third generation Latino families, suggesting that sons and daughters of immigrant Latino families continue to endorse and strongly are influenced by this emphasis of prioritizing family over their own needs. In this collectivist culture, group activities are dominant and responsibility is shared and accountability is collective. And as we will learn, this cultural value has health benefits. Okay, so now to the numbers. So now to these statistics. So the Census Bureau estimates that there's roughly 62.1 million Hispanics in the US as of, and I apologize, I don't know if my chat is coming, my text messages are coming through, but we are a rapidly growing group and account for 51% of the population growth in the US. 67% of Hispanics currently in the US are US born, 13 are foreign born but naturalized, and 20% are foreign born non-citizens. Here are some trends that I would like to make you aware of. So we are young and we are growing. So in the 2020 census, Generation Z, so those born between 1997 and 2012, were the largest audience within the Hispanic community. Census data showed that in 2018, the average age for Hispanic person, so this is how the census counted someone, Hispanic, was 11, while the most common age for white individuals in the US was 58 years old. A quarter of the children in the US are Hispanic, and in 2019, 22% of the women who gave birth that year identified as Hispanic. So again, young and growing. Where do we live? So historically, many Hispanics have lived in certain parts of the United States. For some of them, they have had roots there for centuries, reaching back to before statehood was even established, while others have immigrated more recently, typically to gateway cities where they have connections to family members who have immigrated. The Southwest in particular, so California, Texas, Arizona, have had larger Hispanic Latino populations. And in the 2020 census, it showed that the states with the highest concentration of Hispanics are California, Texas, Florida, New York, and Illinois. And much of this is accounted by their very large metropolitan areas such as Los Angeles, Houston, Miami, Chicago, and New York City. But there's a trend emerging. In the past 20 years, states where Latinos historically have not settled have been experiencing large population growths. So this includes Kentucky, South Carolina, Alabama, and Tennessee. Another big trend that we see is diversification. So we are not just Mexicans. Mexicans still account for the largest share of the US Latino population, but the Latino population is diversifying with the fastest growth occurring among Latinos of Venezuelan, Paraguayan, and Guatemalan descent. But again, Hispanics doesn't refer to a race, but rather an ethnicity, and the US Census goes a step further to try to categorize Hispanics, Latinos into race. Using the 2020 census, we see that Hispanics, as defined in the census, identify themselves as some other race. So 26.2 say some other race, followed by white at 12.6 million, then American Indian with 1.5 million, and then Black, Latinos, or Hispanics with 1.1 million. At the same time, more than 20 million Hispanics identified with more than one race in the 2020 census. So we've been seeing this change where Latinos, Hispanics, Latina folks have been identifying as more diverse. So this might be because of the changing of the census forms, which has added a space for writing a response to the race question, as well as just the growth of diversity among Hispanics in the US. So Latinas are here and our population is growing. We are diverse with our family roots reaching to different countries, speaking different languages, having different experiences. And when working with this population, different cultural elements need to be taken into account when considering health. So those elements include, but are not limited to, language, religion, belief, food, nutrition, and other health elements. So this brings us to Latinas and health and some of the more priority health concerns that we see among Latinas in the US. So COVID really changed things up in the realm of public health. Before 2019, 9 out of the 10 leading causes of death had remained pretty much the same, with some of these conditions switching ranks, but heart disease and cancer, or malignant neoplasm, as it's called here, remaining the top 2 leading causes of death among Hispanic and non-Hispanic whites. But we will get back to COVID. As you can see, in 2020, COVID was the #1 cause of death for Hispanics. So cardiovascular diseases. Cardiovascular disease, or CVD, is the second leading cause of death for Hispanics in the US in 2020. What is cardiovascular disease? So cardiovascular disease is a general term used to describe diseases of the heart and the blood vessels. So blood flows to the heart, brain, and body, and that can be reduced when there's a blood clot or buildup of fatty deposits inside the artery, and this leads to those arteries hardening and narrowing. So significant risk factors for cardiovascular disease include hyperlipidemia, or high cholesterol, tobacco use, diabetes, obesity, hypertension, or high blood pressure. The 4 main types of cardiovascular disease include coronary heart disease, stroke, peripheral arterial disease, and aortic disease. And most of these deaths caused by cardiovascular disease can be easily prevented by making lifestyle changes, such as eating better, starting an exercise program, or stopping smoking. It is estimated that cardiovascular disease is responsible for around 1 in 3 premature deaths in men and 1 in 5 premature deaths in women. All right, so diabetes. So using the 2019 US Census data, we come to learn that 37.3 million people of all ages account for having diabetes. 37.1, so most of them are adults over the age of 18. So diabetes is a disease that occurs when your blood glucose, known as blood sugar, is too high. Blood glucose is the main source of energy for your body, and it comes from the food you eat. So we have an organ called the pancreas, and the pancreas produces a hormone called insulin that helps glucose from food get into cells so that we can use it as energy. But sometimes your body doesn't make enough insulin, or none at all, causing the glucose to stay in your bloodstream and not reach the cells. So having too much glucose in your blood can cause health problems. Some related health issues associated with diabetes include cardiovascular disease, chronic renal disease, neuropathy, dental disease, nerve damage, and foot problems. Hispanic populations are disproportionately affected by diabetes. The incidence of diabetes in Hispanics has been increasing compared to those of non-Hispanic whites. Diabetes mortality also disproportionately affects Hispanics. Hispanic women also have a higher incidence of diabetes than non-Hispanic women. So our third leading, I think it's the third leading cause of death among Hispanics in 2020 was unintentional injuries. And this one has been moving up, not only in Hispanics, but across all race and ethnic groups, ages, and genders. One of the reasons for its sudden increase may be due to the rise in poisonings, which may be related to substance use. The 3 leading causes of unintentional death were motor vehicle, accidental poisonings, and falls. Mortality rates were higher among males than females, and although there has been an increase in mortality rates in the female population, due to substance overdose and suicide. So cerebrovascular disease. Cerebrovascular disease includes stroke, carotid stenosis, or the narrowing of the carotid artery, spinal stenosis, or the narrowing of the spinal canal, intracranial stenosis, the narrowing of the artery in the brain, and aneurysms. And it's essentially any disease that affects blood flow to the brain. Having diabetes, high blood pressure, high cholesterol puts you at risk for CVDs. Research on CVDs in Hispanic and Latina populations is limited, and oftentimes cerebrovascular disease and cardiovascular disease are kind of grouped together. Strokes specifically have been studied, and the numbers show that Hispanic populations have high incidence of vascular risk factors such as high blood pressure, high cholesterol, and diabetes, which puts us at higher risk for stroke. A research study by Bay et al. Shows that Hispanic Latinos have a high prevalence and awareness of vascular risk factors, but we are less likely to adhere to those strategies to prevent future strokes. So there is a big benefit in targeting this group with interventions. All right, so COVID-19. So unfortunately, the COVID-19 pandemic was an excellent example of how health conditions are far more likely to affect Latinas compared to white Americans. Hispanic Americans were far more likely to have been hospitalized or died because of the coronavirus. Hispanics accounted for 19% of the reported COVID-19 deaths and 29% of the COVID-19 cases in the country as of June 29, 2021. So why are Latinas more at risk for death and hospitalization? Well, according to the CDC report, one of the risk factors that affects Latinas disproportionately is lack of healthcare and exposure to the coronavirus from jobs that require frequent contact with others. So as a population, Latinas were less likely to get tested because they were less likely to have insurance. There was an assumption that there was a cost for the COVID tests, when in reality, they were free. We are more likely to have jobs on the front line. Only 16.2% of the US Latinos can work from home. We are overrepresented in high contact jobs such as food, retail, and hospitality with little or no paid leave. And there's many other risk factors as well. Though Latino households were just as likely as households of residents who were born in the US to suffer economic hardship, those who identified as Latino immigrants without US citizenship and without green cards reported more job loss and loss of wages compared to their naturalized counterparts. In a survey conducted by the Pew Research Center, it was found that Latino parents working outside of their home were more likely than those working at home to say that their children were having a difficult time with the pandemic. 58% worried that their children were falling behind as a result of the coronavirus. Okay, let's see. Okay, so I feel it's important to talk to you about the Hispanic paradox as it pertains to life expectancy as we talk about health disparities faced by Latinas. There's an epidemiological finding that Hispanic Americans, despite having lower average income and education than the majority, tend to have better health outcomes compared to US non-Hispanic white counterparts. And sometimes people will say, well, we don't have to worry about things because we're healthier. But no. So this is the Hispanic paradox. Public health researchers have attributed this finding to better lifelong health habits, such as lower smoking rates, better diet, and a social support network that we have built that is stronger than non-Hispanic white populations. And this trend is at least seen in the first few years after immigrating to the US. But as Latinos, we shouldn't just sit on our laurels and act like we shouldn't be concerned, especially because Latinos face a number of barriers in accessing health resources, and we are seeing second and third generation Latinos born and raised in this country have higher obesity rates, higher blood pressure, higher smoking rates, higher cancer and heart disease rates than their more recently immigrated counterparts. Acculturation among new immigrants and their children has seemed to weaken those positive health factors and led to the adoption of ones from the US culture, such as smoking and alcohol use. So Latina populations have a higher rates of diabetes, multiple forms of cancer, high blood pressure, obesity, HIV rates, and other sexual transmitted diseases compared to whites. The incidence is high in comparison to white populations. I'd like to kind of point out Latina men specifically, and we see these patterns in public health as well. Men tend to be disproportionately affected by health conditions, but for our Latina men, there are some specific health conditions that are seen in greater numbers in Latino men than their white counterparts. Liver and stomach cancer deaths among Latino men are nearly twice as high as those of white men. Latino men are 3 times more likely than white men to be diagnosed with HIV. And heterosexual Latino men are 4 to 5 times more likely than their white counterparts to be diagnosed with HIV in the US. Researchers have come to understand that masculinity and the role it plays in the Latina culture can oftentimes be a barrier for men in practicing healthy behaviors. But for Latinos, much of the research centers around the concept of machismo. Machismo being the concept of social norms that encourage men to be aggressive, sexist, chauvinist, and display hypermasculine attitudes of behavior. High levels of machismo have been associated with higher levels of depression, heavy drinking, poor diet, and other risky health behaviors. It is important to note that while machismo oftentimes is associated with being negative, there's also some positive aspects to machismo that include protectiveness, responsibility, and strong work ethic that I like to let people know about. Okay, so as mentioned before, there are some challenges for Hispanic Americans when it comes to health. So number 1, overall Hispanic adults are more likely to face language barriers, particularly recent immigrants. Number 2, more likely to face cultural barriers or be less familiar with or understand how to navigate the health systems used by the majority. Number 3, we are less likely to have health insurance and therefore don't know how to use health insurance. And if you don't have insurance, even if you have insurance, it can be super confusing. Even for an English speaker, it's hard to understand how the competitive healthcare system works. Now imagine being someone whose family never had health insurance. How do you figure that out? Or someone who doesn't speak English. Also, being undocumented makes someone unqualified for Medicare and Medicaid, so you might not even have insurance. So lots of issues with insurance. Number 4, preventative care. So we are less likely to seek preventative care, possibly related to not having insurance or understanding how to navigate the healthcare system. And lastly, number 5, we are at greater risk of facing health disparities, such as living in areas that have higher environmental problems or being employed in higher risk occupations. Okay. So the impact of language. I wanted to delve a little bit deeper into language. Latinas have ties to Latin America, and those ties include food and art, but especially the language. The number of Latinos who speak Spanish at home continues to grow, in part because there's more Latinos immigrating to the United States. But there is a share of Latinos who live in the US, and they, for generations, and the ability to speak Spanish has kind of declined. So despite the drop-off in use of Spanish, Latinos agree that speaking Spanish is important. For many Latinos who don't speak the language, they often feel like there's something missing, or that they have doubts of their own Latinidad or their own Latino-ness because of their inability to speak the language. But to those Latinos, Latinas, I say you are still a Latina, as you are part of the culture and our roots connect us all together. But in the United States, this country where we primarily speak English, we really push our immigrants and non-English speakers to learn and interact in English as soon as possible. In the past, and not very far past, non-English speakers were punished or ridiculed for not speaking English. And so it comes to no surprise that some of those Latinas, especially those who have families for 2 or more generations, have lost the language. I have a quote here that reminds me of how lucky I am that I wasn't in the US or my family wasn't here in the past 2 or 3 generations, because I hope that there's more acceptance to speaking both languages now. But for those who have recently immigrated, the English language can be a barrier to services. And there are some myths and misunderstandings surrounding the acquisition of language. Know that Spanish speakers can't learn English in a year. They can't acquire a second language that quickly. It could take as long as 12 years, according to research. Also important to note is that learning 2 languages at the same time will be confusing for children. Research has shown that it's not. Research has shown that Spanish speakers who learn English may lag behind monolingual English speakers, but just for a short time. That research also shows that by 5th grade, bilingual students will surpass monolingual peers in academic achievement, and learning a second language has been shown to create creative problem solvers. Lastly, it is important to note that there is not one form of correct Spanish that everyone should be speaking. Many library workers who interact with Spanish speakers daily will often mix English with Spanish through code switching or use Spanglish to help communicate with native Spanish speakers. Public libraries need to recognize an individual's ability to code switch and communicate with someone using 2 different languages as a special thing that demonstrates a high level of cultural competence. So language as a barrier. So language can have a direct impact on healthcare, health outcomes, and disparities that Latinas face. Research shows that communication between doctors and patients who speak different languages leads to longer hospital stays and higher incidences and medical errors to patients. Patients who speak different languages than their healthcare providers also receive less health education and experience greater dissatisfaction in quality of care. Patients with limited command of English are less likely to use preventative care and public health services and are more likely to end up using an emergency room where they receive fewer services than their English-speaking counterparts. Solutions to language as barriers include providing training to an interpreter on medical terminology and medical ethics, assuring that health information is given to the patient in their language, having an in-house translator and interpreter, and subscribing to or paying for phone line or language line services or video language services. So now that we recognize that Latinas face several barriers when accessing health information, when Latinas or anyone is trying to access health information, where do they go? So there is a need for more research in this area in how folks gather and access health information. There's some research articles on health information seeking behaviors of the general public and less on Hispanic Latinas specifically. But one study by Fared et al. Found that Hispanic respondents relative to whites had lower odds of seeking health information and trusting health information from doctors. They had higher odds of trusting health information from the radio, the internet, television, and religious organizations. White respondents, on the other hand, were more likely to seek health information compared to Hispanics. So they're out there asking those questions, looking for information. They also sought health information from health professionals like doctors, and they use the internet, television, radio a lot less than Hispanics when accessing health information. So where do we go and where do Latinas get their information? So according to the Hispanic Marketing Council, overall, Hispanics spend less time on live TV than their white counterparts. Hispanics are also avid movie viewers, and we watch more kid shows and late local news compared to the general population. We are all about YouTube. So Latinos spend notably less time on traditional TV and more time on streaming video. So YouTube accounts for 21% of the viewing minutes of Hispanics, according to the study by the Hispanic Marketing Council, so June 2021. The top 3 types of program that Hispanic streams are movies, comedies, and documentaries, but they also stream novelas, kids shows, local news, international programming. Latinas' increased use of social media, radio for news makes us vulnerable to health misinformation. I did want to mention radio. So on average, Hispanics spend about over 12 hours per week listening to radio, 33 more minutes than non-Hispanic counterparts. For social media in general, Facebook reigns supreme among Hispanics. So however, we do use messaging apps such as Signal and WhatsApp, and Snapchat and TikTok are gaining use quickly. Young Hispanics aged 18 to 34 are 2 times more likely to use WhatsApp and Telegram as the general population, and are heavy users of Instagram and Discord. So as Latinas, we gather information from YouTube, radio, and social media. These information resources are less reliable than talking to your health professional. So adding in another layer of confusion, we have misinformation and health misinformation. So what is misinformation and what is health misinformation? So simply stated, misinformation is false information that is spread intentionally to mislead. It might mislead, it might not mislead. Somebody might have not meant to do it. And health misinformation is health information misinformation that is shared that might be intended to mislead or might not be intended to mislead. On the other hand, disinformation is biased information that is purposely put out there to deliberately mislead, manipulate the narrative or the facts. Fake news, on the other hand, is information that is purposely crafted to be sensational, misleading, and it looks like mainstream news. So for us librarians, providing accurate and reliable health information is critical and so important, and such a big part of what we do. The ALA Code of Ethics, the first principle, states that we are to provide the highest level of service to all library users to appropriate, usefully organized resources, equitable service policies, equitable access, and accurate and unbiased and courteous responses to all requests. So it is what we do. We are choosy about the materials we choose for our patrons, specifically as it pertains to health information, and we want to assure that we're sending our patrons to health information that is reliable and accurate. But recently with the COVID pandemic, it has highlighted the prominence of misinformation, especially the misinformation surrounding vaccines and the origin of the vaccine itself. I have worked in helping connect folks with health information for a while now, and I can tell you that it feels more overwhelming now. It is more prominent. It feels like more people are using social media, and the general public is relying on the internet for news and information. And it's just made the spread of misinformation more overwhelming. There has been some really great news stories recently about misinformation in the Latino community as it pertains to political information. I would love to see more news stories on health misinformation. So I wasn't able to find too many, but I would love to see these stories come out. But there were some really great concepts that were shared from these articles. The article suggested that Latinos' resilience Latinos' reliance, on digital media for political information has made them vulnerable to misleading information. According to the Pew Research Center, Latinos use social media, mobile apps, and other digital print platforms at a higher rate than the majority population in the US. And this saw an increase during the COVID-19 pandemic, with social media rivaling television as a dominant source of news content. And it's not just YouTube that could be problematic. Traditional formats of media, such as radio, have been proven to be susceptible to false information. This, for me, is problematic personally. This is where my interest for this topic arose. So I'm a Latina who is losing her ability to speak Spanish because I don't work around Spanish speakers anymore. So I started listening to Spanish radio to try to kind of listen to the language. And the amount of misinformation related to health and politics was atrocious. I don't know how Spanish language radio gets away with saying such false information, but they do. So here I have provided a link to a really great news article by Last Week Tonight that touches on health misinformation, but in the Filipino communities. But you can essentially just kind of draw a line through Filipino and put Hispanic, Latino, because it felt like they were talking about my mom. So it is so worth checking out. And there have been solutions discussed, but I still don't feel like it's enough. One solution that has been discussed is that social media companies should budget more money for combating misinformation. I have seen some progress as it pertains to English language postings on Facebook, for example, but not on Spanish language postings. I've heard the excuse that, well, we have more English speakers working on Facebook, working on clearing up misinformation, and not enough in Spanish. But really, please get to that. We also need a high-level Latino representation and ownership of media. And a long-term strategy would be improving health media literacy for the general public. So states like Illinois now require a news literacy course at every high school. And lastly, I've seen some social media content producers creating informative, reliable, accurate health content in order to combat health misinformation. All right, so now we're going to talk about things that libraries can do. So I was reading up on transcultural nursing, and there were two concepts that came up that were important in building relationships with Latinas as it pertains to nursing. That is the idea of confianza, or building trust, while respeto refers to sharing mutual respect. So when getting trained as a medical interpreter, this was stressed to me. And as I was typing this up, I was like, oh, this pertains to libraries. Actually, this pertains to any organization that's trying to grow their Latino involvement. Confianza, or trust, is incredibly important in the patient-caregiver interaction when working with Latina patients or patrons. Patients and caregivers will use humor and small talk to build a relationship. Caregivers should be aware and patient when these patients are recounting a story or giving an explanation that's not straightforward. It is chock full of information that might be helpful as you're coming up with a care plan. Respeto, or the respect, goes both ways. First, Latinas have a great deal of respect for authority figures like doctors and caregivers. And we as caregivers will also show respect to those we care for, using more appropriate pronouns like usted instead of the less formal tú, especially with those older than us. So I was reading about some best practices for connecting with Latinas in your library specifically. So we start, libraries should develop services that reflect cultural competence and recognize Latinas as an asset to the community. And this does not just happen. It's a process that takes time and effort. Public libraries need to recognize that they need to implement changes in services to better serve Latinas. The first one is get Latinas involved. Hire us to work at your library, recruit. If you're going to be using volunteers, recruit and incentivize. So our time is valuable. Please incentivize us for our time. After getting Latinas involved, you need to learn more about the Latinas in your community. This is done through a community needs assessment. A community needs assessment is a fancy term for gathering information about the community needs and assets. There are many ways to do an assessment. It could be done by talking to community members or library staff, having community members fill out surveys, by gathering statistical information from the U.S. Census and other government organizations. And of course, involving Latinas in the assessment process is crucial. A third practice is recognizing language and culture as an asset. Being unable to speak English should not be a reason to penalize people. We are libraries providing resources to folks, and we want to create a culture where people know that libraries are there for them. And what better way than to recognize them as an important part of the community? This goes for many other diverse cultures in our community. We're all special. We want to see Latinas and any culture in the community reflected in libraries. This would involve hiring staff who reflect the community and acquiring collections about and buying materials and displaying them properly. This would include displaying images of Latinas in the library, on the website, creating Spanish language signage and Spanish language website, and having these resources available to them. And then lastly is making libraries making Latinas feel welcomed at the library. Again, number one, having Latina staff, ensuring that the collections are easy to access, creating a website and signage in Spanish, and providing instruction and programming. And that would be in both English and Spanish. A couple other best practices. So the first one is Latina involvement in programming and services. So you'll start seeing a pattern here. Having worked in public libraries and knowing all the thought that goes into putting a program together, and then the frustration of having no one show up, reminds me of this next best practice. So it's very important to have involvement from Latinos in planning your programs and in the library services that we provide. There's some things that we don't consider, is transportation an issue? What type of program is enticing enough to bring someone in? Are there work schedules or major employer that has a certain schedule that we're not accounting for? Are there family dynamics that we need to contend with? The best way to figure these things out is to have Latinas involved in the planning of these programs. Recognizing and promoting Latina literary interests. So when recognizing and promoting Latina literary interest, again, having input from Latina community members is important. Therefore, libraries should work to recruit community advisors to help them in planning programs, choosing books, having book clubs, and then requiring the collections department to make them readily available and visible to the Latina community members. Also knowing the reading, writing, computer literacy levels for both English and Spanish speaking Latina community members. Libraries need to prepare their staff, so providing professional development for their staff. So we need some education for our staff about how to better serve growing Latina populations. This is done by providing professional development to individuals who understand and value Latinas as an asset. And it must be culturally competent and research-based. Lastly, libraries need to collaborate with community organizations, especially those that serve Latinos. For those libraries that are not involved with Reforma at a state or national level, get involved. We need to connect with schools and health organizations as well that serve Latinas. Okay. So public libraries and health. So concept of health promotion in libraries is not a new thing. It feels like a new thing for some of us, but it is not a new thing. Librarians have assisted with information sharing since the pandemic of 1918. So we've been there working together. We need to understand before we jump in that health promotion and health literacy is very important to all our patrons. It's hard enough to understand health information in English, but even more in Spanish, and that is a barrier. Libraries and public health, to me, equal a great partnership. Having worked as a health educator, we had the resources and the expertise, but we had a hard time recruiting folks. Meanwhile, libraries have the people and the funding and the space, so we make perfect partners. So I just wanted to share here providing some culturally competent services through collections, of course, creating and making available materials for children, young adults, and for adults, having an online presence that highlights Latino programming and includes images of Latinas. So here I had mentioned that there's 3 ways to really connect with communities. The first one is through collections. The next is through outreach, and that's connecting with the community, collaborating with community organizations, and providing outreach to Latinos, which requires Latina involvement. And then through programming, we want to create programs for Latina children and youth and for Latina adults. Of course, many of these programs are very similar to what we provide already in libraries, but available in Spanish as well. And I'm kind of hustling because I just noticed the time. So I'm just gonna wrap this up pretty quickly. So some ideas for health programming that we have seen nationwide in different libraries. So libraries can provide health information to Latinas by being a health space. We can provide spaces for healthcare and social workers. We can provide spaces to health-related services. So if you have social services come in and provide appointments at the library to make it accessible. We provide access to hygiene products. We provide spaces for telehealth. Libraries can also be pantries. We have seen teen pantries like the one seen here from the patent-free library, where they provide things that might be of interest to teens. We have love fridges and little free pantries, which provide free food to community members, seed libraries, house plant exchanges or plant swaps, free meal programs by working with food banks. Health education classes. So this was what I did when I was a health educator, working with libraries to teach. So working with Cooking Matters, the SNAP program, which is a food stamp program to provide health education, physical education programs such as mindfulness story times, yoga story times, dance parties, story walks. We can look at older adult interests such as senior fitness, Medicare workshops. One of my most popular programs at the public library was bringing in a Medicare health insurance provider and answering questions, mental health programs as well. Some programs that I've seen that have specifically targeted Latinas. The Newcastle County Libraries in Delaware did a story walk, but it was bilingual. The Denver Public Library has memory cafes, so cafes for those who are experiencing memory loss or Alzheimer's, but in Spanish. The LA Public Library has done great programs where they incorporate Mexican music and dance to promote movement and exercise. I'm particularly proud of this one here. The Natural Health Exchange. It's a program from Trinidad Public Library here in Colorado that they brought in a natural healer to share her knowledge with Spanish-speaking communities. And they also provided an English interpreter for those who are interested. A collaboration with the Parkland Hospital in Dallas, Texas. They did a series of 4 classes to improve health. The Chicago Public Library has a COVID resource Thursday where they bring in community members to provide masks and vaccine information, at-home COVID tests for free to all patrons. So as we wrap up, Latinas are a diverse group of folks. As a group, Latinas face several barriers to health. Libraries and health are a great partnership, and you have to get Latinas involved. And if you're going to ask for volunteers, please incentivize. Okay, and I'm sorry I took up much longer than I thought.
It is totally fine. Thank you so much. That was
so I rushed it there at the end, but I'll make the PowerPoint available. I was like, okay. Oh no.
Okay, good, because that was one of the questions. Will the presentation slides be available? They weren't on the website, so just reach out to Maggie to get the slides. And someone asked about speaker notes too, if possible.
Oh, yes. Okay. I'll share everything.
Okay, cool. So just reach out to Maggie to get those slides and speaker notes. So another question, do we have a sense of how many / what portion of Hispanics are dominant Spanish speakers?
You know, and I like did my little research. I swear to you, I went digging, but I couldn't find a number, but I can get that to you. Oh, that's anonymous. Let me see if I can look at my notes and I can find that for you.
Okay, sounds good. And we just have one last one. Can you share more about the surprise that mis/disinfo is on Spanish radio? I'm thinking about it in comparison to TV.
Oh, so this is my story. So I went on there on Spanish radio to listen to it, and they were talking about curandera, so healers. And this guy's like, well, he was very clearly stating COVID symptoms. I can't breathe, I can't taste anything. And the guy's like, well, somebody has put a curse on you, and you need to call this number and we will uncurse you if you pay us some money. And I was like, oh my gosh. So I think that there's less, I don't know that answer, there's less oversight on radio than on television. That's what I was able to gather from some of the research that I was looking at, is that there just seems to be less oversight for Spanish language media in general.
Thank you so much for answering that. Okay, I know there is a Latine population in our region, but it's difficult to reach out to them in the places they frequent. What is the best strategy to reach out to this population? Social media, religious organizations?
So for me, my experience has been hiring Latina staff. They're going to have the insight, and you might be like, well, we can't hire Latina staff. They're not available. They're not qualified. In public health, we have a really great model called a promotora model, where we get lay community workers to come in, and they kind of get taught a little bit about health education. And this has been proven to be a great model in public health to connect health information and Latinas together. I don't know why we can't do that in libraries. So that would be the first thing. If you're like, well, I can't hire anybody right now. If you find one person, if you connect with one Latina person in your community and in your library, and you incentivize them, like, hey, bring some people to story time. If you find one person that kind of can act like that community lay worker, that promotora to promote your programs, that has always worked for me. And I went everywhere. I would go to laundromats, I would go to restaurants, I would go to panaderias, places that we would frequent to promote, but nothing worked as well as connecting with somebody who's already entrenched in that community.
That makes sense. Thank you so much. And last question, which Spanish radio do you listen to?
It's a Denver or a Greeley, Colorado. You see, and I don't understand. I would get so mad. I know that they would do national programming. Mine is Tigre 1450 in Colorado. But they would do national level broadcasting.
Well, thank you.
Yeah, and so I just Googled for our person Hispanic breakdown into 3 groups. So you'll find it just feels like you go down this rabbit hole where you keep finding even more recent and even more recent and even more recent information. Hispanics from the United States break down into 3 groups when it comes to the use of language. 36 are bilingual, 25 mainly use English, and 38% mainly use Spanish. So that is from a government. That's a Pew. That's 2013. You see, it's not even recent.
Yeah.
But email me. You've got whoever asked that question and is anonymous. Email me, and I would be glad to. We can have a conversation over Zoom, and we can dig together.
Sounds good. You heard it here. Thank you so much.
All right. Well, thank you.
Yes, great questions. Thank you. So I have to wrap it up here. So thank you, Maggie Shawcross. Just a few items before we end this session. If you're interested in claiming MLA, Medical Library Association, continuing education credit for this session and others, you will receive an email after the symposium ends with a questionnaire and instructions to claim CE. And thank you for joining us for day 1 of the Health Misinformation Symposium. This is our last session for the day. We look forward to seeing you tomorrow for our keynote. And before we wrap up, I want to encourage you to join the network. Membership is is organizational, not individual, and offers benefits such as funding opportunities and print resources. Thank you so much today, everyone, for coming.
Thank
and
you.
we'll hope to see you tomorrow.